Welcome to our Hormone Happy Hour. Our topic today is going to be on hormone testing. So, would you believe that one of the most important tools for female health optimization is overlooked in the traditional medical setting? So, in traditional allopathic conventional medicine, hormone testing for women in perimenopause and menopause, it's actually believed by many doctors to not be important at all. It's something that they say that hormone testing is not accurate. I mean, they're talking about all hormone tests. There's no need to test your hormones. And it's really kind of wild. And it's really a shame because one of the big reasons why so many women suffer needlessly in perimenopause and menopause is because they're not getting their hormones tested. They have a hormone deficiency. They're depleted in hormones. And so today we're going to talk about why every woman, regardless of their age, should be testing their hormones, and also how you can do this affordably, whether you go to a local lab and get your blood drawn, or whether you do a at-home hormone test, which I hate getting my blood drawn. Full disclosure, I'm a doctor, but needles and getting your blood drawn really kind of freaks me out a little bit. So anytime I can do a saliva test or a dry blood spot test or a urine test, sign me up. I'd rather do that than get my blood drawn. But either way is okay initially if you are just checking your hormones to see if you want to possibly replace them or just to get a baseline. If you're feeling kind of crappy and you're feeling like your doctor's told you about osteoporosis or cholesterol's rising, or you're just starting to not be able to sleep well, or you're gaining some weight, or your skin's starting to feel wrinkly and old and crepey, and you're starting to notice more wrinkles than normal. All these things are signs of low estrogen, progesterone, that your hormones are declining. And it's normal. It's nothing wrong with you. There's nothing abnormal about you that your hormones are declining. Because like I said, every woman who will live to 50, 55, that age, you're going to have hormone decline. You're going to go into menopause and you're not going to make your hormones anymore. Point blank, you'll make a teeny tiny bit, but nothing to protect your heart, protect your bones, protect your brain, protect your breasts, and prevent all of the kind of like troublesome, frustrating symptoms of, I gotta turn my phone noise off, all of the frustrating symptoms of hormone decline. So for those of you who don't know me, maybe you were invited by a friend, I'm Dr. Michelle Sands. I'm a naturopathic physician, female hormone expert. I specialize in menopause and perimenopause and hormone imbalance in general. So on this channel, on my YouTube channel, I share tips and tools to help women understand and fix their hormone problems. So if you're new here and never been here before, feel free to pop your questions below. And I read every single question. And even if I don't get to it right here on this call, I will answer the questions in the chat or in the comments. And if you are watching the replay, just go ahead and pop your question and you can still participate in this conversation. Let's see. So hormone testing, where do I start? So it's pretty common knowledge that hormones like estrogen, progesterone, testosterone, these are pretty important in our overall health. Most people know this. And we understand that there's problems with too much hormones and problems with too little hormones, right? There's the Goldilocks scenario. If you know Goldilocks and the Three Bears, there's too much, there's too little, and there's just right. And hormones are very, very Goldilocks. Same thing with Cinderella. You can call it the Cinderella effect. The shoe's too big, the shoe's too small, the shoe fits just right. And so with excess hormones, we have things like weight gain, PCOS, endometriosis, sometimes fibroids and cysts. And then hormone deficiency on the other end of the spectrum can lead to things like brain fog and muscle loss and hot flashes and sleep problems, osteoporosis, skin aging, vaginal dryness. The list goes on and on and on. There's like 99 symptoms of hormone decline that women face that we often don't know about. Things like tinnitus, like ringing in the ears, joint pain, arthritis. All of these things have been linked to hormone decline. And also there's like the serious health conditions. So the big three that really affect women: heart disease, Alzheimer's disease, and osteoporosis. Those are the big killers of women in menopausal age. And you can actually prevent those from happening if you replace your hormones up to the optimal level. Well, how do you know how to do that? Well, testing is really important. And so when I think back, when I was a young girl and I was having all kinds of problems and horrible pain around my menstrual cycle, no one tested my hormones. Even in adolescence, when it was clear that I had a hormone imbalance. I had acne, I had pain. I would have my period and not have my period. And it was excruciating. I had to stay home from school. No one tested my hormones. It wasn't even a thought. They just immediately put me on birth control pills. And this is the case for many, many, many women. And I got the same exact dose as any other girl who had a period problem or anyone who wanted to prevent pregnancy. But I was 12 years old, so I was not sexually active. And I hear the same thing from women going through postpartum struggles, for women in perimenopause and women in menopause. So why on earth, why would we not test hormone levels? And unfortunately, it's the exception rather than the rule in allopathic medicine. It's believed that it's not medically necessary to test your hormones. Instead, like the standard of care is that if women are over age 40 and they're experiencing all the symptoms of menopause, the first line of work here is to prescribe antidepressants or the birth control pill, or sometimes pain medications to cover up the symptoms of the hormone decline. Sometimes you might find a doctor who's willing to prescribe hormones, but they won't even test your hormones then. They're just going to give you the dose based on a hunch, based on subjective assessment, or just the same dose they give every other patient in your demographic. And most medical schools don't teach at all about midlife hormone imbalances. You know, your gynecologist, your wonderful doctor that you've been going to your whole life, they learn a lot about reproductive health. They learn a lot about pregnancy. They learn about childbirth, postpartum. But that's really where their education ends, and they don't learn about the natural hormone decline that comes with perimenopause and menopause. So instead, they're taught pharmacology. So they're taught about prescribing drugs to cover up the symptoms. And these are the same medical doctors that lack the education around hormone testing. Although it's really kind of funny that standard of care for men, should they have testosterone imbalance symptoms, is to immediately test their testosterone. Crazy, double standard, not fair at all. In this day and age in 2023, we should be testing female hormones. And one of the things that conventional medicine doctors will say, and even some functional medicine doctors, and even lots of hormone clinics will say, you don't need to test hormones because hormones fluctuate throughout the month. Hormone levels can vary, and they're just going to be low if you're in menopause. And while there is some truth to that, yes, hormone levels do fluctuate throughout the month for women still cycling. And yes, hormones are likely going to be low in perimenopause and menopause. However, I've had many women in menopause who have high levels of estrogen due to growths or tumors or something else going on in the body that we would not know had we not tested the hormones. And the fact that hormone levels fluctuate does not cancel out the necessity for testing hormones in women who are still cycling. It just means that you need to be smart about how you're testing hormones and when you're testing hormones and how you're evaluating that hormone test, right? So when we're looking at hormone testing for women who are still in their reproductive years, we test on specific days. For those of you who know how your menstrual cycle works, the first day of your menstrual cycle is the first day that you bleed, and then you usually ovulate around mid-cycle. So let's say around day 14 on an average 28-day cycle, but some women have a longer cycle, so they'll ovulate a little bit later. Some women have a shorter cycle, so they'll ovulate a few days earlier than day 14. But the goal is to test your estrogen and progesterone levels 5 to 7 days after ovulation. So usually for most women, that's going to be between days 19 to 21. Now, if you're looking for fertility, you can also test your luteinizing hormone, your follicle stimulating hormone, and your estradiol levels on day 3 of your cycle, because that's when those are going to be the highest. But if you're looking to see if you have estrogen dominance and you're looking at your hormones in a sense of balance, your estrogen and progesterone, days 19 through 21, about, like I said, 5 to 7 days after ovulation, that's when you're going to have that peak in the later phase of your menstrual cycle, and that's going to be one of the best days to test. So we're not really worried about the fluctuation throughout the month because we know when we're testing based on ovulation and where your levels should be in order to be optimal. And then also we look at symptoms too. So when we do testing in our practice, we test your estrogen, your progesterone, your testosterone, but we also do an analysis of over 70 symptoms every time we do that hormone test. And then we're looking for your symptoms matched up with your levels to create a actual plan for you. And in those symptoms, we're also looking at symptoms of high and low thyroid. You might want to also test your thyroid levels. We're looking at high and low cortisol symptoms. And then we might consider a cortisol test as well. So we're able to, or even metabolic syndrome, and we will look to see if we need to test your insulin and your C-reactive protein and other markers, your cholesterol. And so these are things that we can get insights from symptom analysis, but we really want to know those hormone levels. So if you are dealing with heavy periods, long painful periods, a prescription for birth control is not going to fix those. It's not going to solve the problem, and it doesn't make sense. Testing your levels is going to let us know, okay, hormones are high. We need to work on hormone detox. We need to work on exogenous hormone exposure. And all of these things we would not know just with prescribing a birth control pill. It's not going to solve the problem. And what happens is you can end up having DNA damage if that's what's happening, fibroids, cysts. All these things can kind of spiral and pop up as problems later down the line. And if you have low hormones, then that can be a causative factor in osteoporosis, inflammation, diabetes, heart disease, and dementia, like I said earlier. So all of these are super important. And I'll do a whole nother video on the effects of hormones on your body, but specifically what I'm talking about today is testing. And so there's several different ways to test your hormone levels. There's actually many ways. You can get a blood draw. So you can go to your local lab and get a blood draw. These days, you don't even need a doctor to prescribe a blood draw. You can usually go to, there's in most major cities, they have testing centers like Any Lab Test Now, or there's some other ones that you can just walk in and ask for the test and they will run it. Or like in our practice, we will write requisitions for blood tests if that's what our patients want to do. But the most simple and convenient way to test your hormones is through saliva testing. Saliva is great because it works whether you're on hormone replacement therapy or not, no matter what type of hormone replacement therapy you're on. With blood testing, if you're using topical hormones, like a cream or a gel, you're not going to get the accurate levels with serum testing because the topical hormones go into the tissues. They don't stay in the bloodstream, so you're not going to get accuracy from that blood test. However, if you've never done hormones before and you want your baseline level, blood tests are just perfect. But if you don't like doing your blood draw, like I don't, a saliva test is super simple. This is the one that we use in our practice. So it just comes with these little tubes. So if you're just doing hormones, it's just a little tube. You can see that there. Just a little tube that you just spit in. And you just do that in the morning. And you just have to fill that like halfway, and then you send it into the lab and you get your hormone levels back. So it's absolutely wonderful. Now, if you're doing blood tests or you're doing dry blood spot testing, which is another at-home test that you can use where you just prick your finger and you put the little blood spots on this little card. We offer that as well for people that cannot produce saliva. But you're doing that. So that's another way to get your estrogen, testosterone, and progesterone, but also with the blood spot, you can also do thyroid and vitamin D, which is really awesome. So we offer all those testing in our practice. And we're actually doing a sale this week on the hormone trio test, which is the estrogen, progesterone, and testosterone. And you'll get the testing, you'll see the reference ranges, and you do all the symptom analysis as well. And then we can kind of evaluate what's going on with you. And to be honest, like who should get this test done? I really feel like having a baseline of the test, even if you're like at your height, if you're having no symptoms at all, that would be the best time to test, because that is when you're going to know what's right, what's your best level. Because with hormones and really with many, many things in our life, whether it be blood sugar, cholesterol, estrogen, testosterone, there's a range that is like considered optimal, but for each individual person, they have a level where they feel the best. And we can kind of like go backwards. If you've never had your baseline test done and you come to us in menopause and you're not feeling well, we'll kind of trial and error to get to your best. We'll get you into the optimal range and then we'll tweak. In our Healthy Hormone Club, we do testing every 4 to 6 months, depending on the need. And we're always dialing in that number. So we're always keeping you in the healthy range, but you might feel better with a little bit at the little higher end of the range, whereas your neighbor might feel better at the lower end of the range. And so we have to tweak that and work with you to see what is best for you. But as far as the benefits of bone health, heart health, brain health, all of those things, and all of the, reversal of vaginal dryness and anti-aging will get you in that range immediately. That does all those things. But for actually feeling your best, it's going to be different for everybody. And that's why testing is super helpful. And so real quick, I will share my screen and show you guys what saliva test looks like. Let me just share screen. All right, so I should be sharing this now. And so you'll see that my screen's over here. So I'm gonna look over here. This is, I've taken the name off. So this is what a test looks like if you do the hormone trio test, which is actually on sale for 50% off this week. It'll say like your menstrual status. So this person is postmenopausal. And so the ranges are ranges for someone postmenopausal. Now, you'll see that her estradiol level was very, very low, and this is considered normal. Less than 0.5 is pretty much most women in menopause are going to be between 0.5 and 1.7, but this person was even below the menopause range. So she really, really needed hormones. Also with her progesterone, she was below the postmenopausal progesterone range, but her testosterone was still decent. She was in the middle of the range. And so that gives us a lot of information to say that she can really, really use some estrogen and progesterone to make her feel better. Now, this range here is the postmenopausal range. So what if she was at 1.7 and she still had hot flashes? Well, that's normal for menopause, but we want her to be normal for a woman. So normal for optimal. This is where a lot of women get into trouble because their doctor will test their levels. If this lady came up at 0.7, then her doctor would say, oh, your levels look good. You're in the great range for menopause. But the range for menopause is not where we want to be, because menopause is when we have bone loss, heart issues, brain fog, weight gain, hot flashes. That's where all those symptoms take place. So this is not enough estrogen, the postmenopausal range. So when we're replacing hormones, we want to get out of that postmenopausal range into the optimal healthy range. Now, I know this is optimal here, but that's just the lab saying with optimal for someone in menopause not taking any hormones, but that's also the range where you're going to have the symptoms. Now, some women in menopause are low in testosterone, then they need some replacement help there. And some women are going to be high in testosterone, and so they're going to have issues there. But even with this normal testosterone level, what can be happening for this particular woman is she could be gaining weight due to androgen dominance, where she's going to have that belly fat, like that kind of like male weight gain where they gain weight in their belly. She could be having hair loss. She could be having facial hair because her most dominant hormone here is testosterone, and she has no estrogen and progesterone to oppose it. So we really want to balance all those hormones out. And then you can see, kind of has a little chart. And then here's what the symptoms are. So you'll see all these symptoms, pretty much everything we need to know, we evaluate, and we give you this little kind of chart. So she had some symptoms of estrogen and progesterone deficiency, but her main symptoms were high cortisol and metabolic syndrome. So those were not things that we tested, but now we can say, okay, let's support your cortisol with adaptogenic herbs. Let's make sure you're doing a good nighttime routine, make sure that you're getting some exercise, some sunlight. And let's look at your diet to make sure you're eating adrenal supporting foods. And the same thing with metabolic syndrome. A lot of these symptoms can also be due to androgens as well, but things like insulin resistant, high cholesterol, things like that. So that gives us some insights beyond hormones, even though this is a hormone test and we're only testing these three hormones. The reason why she doesn't have a ratio here is because her hormones were too low. But if her hormones were in range, then we'd also have a progesterone to estrogen ratio that tells us about estrogen dominance. So I'm going to stop sharing right now, and I'm going to get to your questions. So hopefully that was helpful, a little bit about hormone testing for you guys. And we'll go ahead and answer questions now. All right. I appreciate you doing things. I'm in the hormone club. I was instructed to take progesterone days 15 to 26 of my cycle. I'm about 29. Curious why I was requested to stop the progesterone a few days before my period. So when you're still cycling, when you're still having a period, we want to strengthen what the body's normal flow is. And basically a few days before your period, progesterone drops, and that allows you to have a period. And then you start up again after ovulation, which is what you're doing days 15 to 26. So we are just supporting your regular menstrual cycle. And then when you stop having a period, then we will have you do progesterone the entire month, but just take a short break because that's what your body is used to. So just like the body needs those hormones in order to operate Optimally, it also needs time without the hormones. It's a couple days a month at least, where it's actually kind of like renewing and cleaning out that receptor site. So for you, Carolyn, we are just mimicking what your body is naturally doing and supporting it, because even though you are still ovulating, so you're still having a period, you're just not making enough progesterone, because progesterone is actually the first hormone to decline. So you start making a little bit less and a little bit less and a little bit less. And then soon, I don't know how soon, I shouldn't say soon, eventually your estrogen will also start declining. And if you're not already doing estrogen now, then we'll add estrogen in, and then eventually your periods will come to an end. You'll no longer be releasing eggs, and then you'll move to progesterone the entire month. So hopefully that's helpful. Can we balance our hormones without creams? Absolutely. There's many ways to balance hormones. So there are some oral hormones that you can take, but I don't usually recommend oral hormones because they do have a effect on the liver. They form some metabolites, and these metabolites can increase clotting factors, so that can lead to things like deep vein thrombosis, pulmonary embolisms, stroke, so clots that go to the brain. So that's why I avoid oral hormones. And then there's patches, there's pellets. So there's many different types of hormone replacement. In our practice, we do use topical creams because those have the least side effects, but there's other ways to do it. Now, if you are premenopausal, so if you are still getting a cycle and you want to strengthen your ability to make hormones, I wrote a whole book, it's behind me, Hormone Harmony over 35. So this is for women, women of all ages, but the details in the book are all lifestyle based. So it's food, it's movement, it's stress reduction, it's sleep, it's environmental toxins. So those are all the things you're going to do besides replacing hormones to really optimize your body's ability to produce hormones. But once you reach menopause, perimenopause, menopause, that hormone production is going to slow down no matter what you do. You can't eat your way to never going through menopause. And so at that point, in order to live optimally, we want to replace our hormones. Just like if your thyroid stopped working, you would take thyroid hormone. If your pancreas stopped creating insulin, you would replace your insulin. But estrogen is so important for reducing inflammation, for helping with insulin resistance, for building bones, for protecting our brain, for protecting our heart, that there's no reason why you wouldn't want to do that. I mean, there's been like many controversial falsehoods and myths about estrogen replacement causing cancer and estrogen replacement causing all of these issues, but those are absolutely not true. And there's a great book called Estrogen Matters, written by an oncologist that has many research studies, like tons of them, that debunk that myth. And I'm going to be creating a whole video on the myths and misconceptions of hormone replacement therapy being dangerous. But the studies show that women who take the correct dose and delivery method of hormone replacement therapy actually live 3 to 7 years longer, have lower incidence of osteoporosis, lower incidence of heart disease, lower incidence of dementia and Alzheimer's. And those are the 3 big killers in women. And they also have less reoccurrence of breast cancer. So they had breast cancer in the past, and they're protected from things like colorectal cancer, so many different things. So there's things you can do to help your hormones. And even in our Healthy Hormone Club, we have the Healthy Hormone Academy that talks about how to eat foods to support your hormones. Have all these workouts for you to help build and strengthen your body to help your hormones be even more balanced. We have pelvic floor exercises, we have breath work. All of these things are so important for everybody, for overall health, including your hormones. And so it's not just about taking hormones, it's really about living a healthy lifestyle, but the hormones allow you to do that, if that makes sense. Let's see, how soon before I start to see results with hormone replacement? Hormone replacement, it varies women to women, depending on how long it's been since you had your hormones, what level you're starting at, how imbalanced your hormones were, what else you're doing in your lifestyle, and what other medical conditions you might have. But usually anywhere from 2 weeks. Some women start seeing results. Some women start to see results like almost immediately. And then it can take up to 3 months to start seeing the results. And then they kind of compound over time. the longest probably result, the longest symptom remedy or symptom relief that it takes is for osteoporosis to see a difference on your bone scan takes about 18 months on consistent hormone replacement. But everything else, I would say between 3 to 6 months, you should have symptom relief. There might be some dosage adjustment that needs to happen. So I would give it the first 3 months on the dose that you're on. And then, of course, if you're in our Healthy Hormone Club, you can book a consultation with a hormone specialist anytime you want, as many as you want. And you can always chat our hormone team. So if you're, give it at least, 12 weeks on the initial, but then after that, yes, we will tweak and dial in and adjust, raise your levels, lower other levels, and get you to the point that you need to be, because every woman's different. I can give 10 women the same dose of hormones and I will get 10 different results as far as their levels are concerned and their symptom relief. So everyone's really individual. We do, of course, we test hormones at the start of the Healthy Hormone Club, and we do that symptom evaluation. So we're pretty good at that initial dose, but everybody's a little different. And so dialing in is super important. Let's see, I plan to start the Healthy Hormone Club very soon, but I have questions, ask away. We are here to answer your questions. If you don't want to do it in this format, definitely email our support. So support@glownaturalwellness.com. And if you want to speak with a hormone specialist ahead of purchasing or joining, go right ahead. Just ask to speak with a hormone specialist, and a member of my team, one of my doctors or nurses, will get back to you and kind of answer some questions if you have them. But that's kind of why I do these two, to kind of get questions answered. But this isn't the format for everybody, so I understand that. Definitely email support@glownaturalwellness, and we are happy to reach out to you. Let's see, is it safe for women over 50 to use supplements like flax, soy, black cohosh, and wild yam for lower hormone levels? So it's safe to use flax, soy, black cohosh, wild yam, etc. And actually flax is super helpful for the fiber and the protein, and soy can give you some phytoestrogen, so it can be protective against certain heart issues and could be protective against cancer, but it's not going to raise your estradiol levels. Neither will wild yam. So even though bioidentical hormones are derived from diogenin, which is a chemical component within the wild yam, it has to be taken into a lab, and some of the chemical backbone has to be taken off in order for it to become estrogen, progesterone, and DHEA and testosterone. You can't just eat wild yam or take a wild yam supplement. That's not going to increase your hormone levels. So none of those supplements will increase your hormone levels. They can help with symptom relief, though. So you might feel that some women anecdotally will say black cohosh has helped with hot flashes. There's no actually peer-reviewed scientific evidence to support why it would do that. But there's some placebo effect, but there's also, there is some symptom relief that comes with a lot of these like menopause supplements. And I don't have a problem with that at all if it's helping your symptoms. They're not dangerous in any way. But what they're not going to do is they're not going to give you heart protection. So protection against heart disease, like estrogen, helps to improve the health of your veins and arteries and your heart. It's not going to protect your bones. So it's not going to build up that inner matrix of your bones to prevent fracture and death from osteoporosis. So most women, women over 65 who have had a break or a fall, the scary statistic is that within 1 year of that hip fracture or that fall, they die. And so that's super scary. You don't get that protection to build the matrix of your bones, and you also don't get the protection for your brain health as well, and the vaginal dryness and the skin health and the collagen building and all those things. You won't get a raise in those hormones from those supplements, but you might get some symptom relief. So they're not dangerous in any way. Is there a full list of tests that we should request from our doctor? Depending on what you're going for, we have what we call our Glow Foundational Wellness Panel, and that is like a whole battery of tests. So if you want to request that from your doctor, what you can do is you can go to glownaturalwellness.com, go to the shop, lab testing, and then find the Glow Functional Wellness Panel, and you can actually print out all the markers that come in there. And that is what I really recommend. So you're going to be testing your hormones, but you're also going to be testing your blood sugar, your cholesterol, your thyroid, and all kind of your blood count. Come on in, and all of your your red blood cells, your white blood cells, immune factors, all of those things. So you can go there and you can print that out and bring that to your doctor. Otherwise, we do offer it as well. And it looks like we have the prize patrol is here. So for those of you who don't know Paxton, Paxton is my son. You're almost 8 years old, right? Awesome. So Paxton loves to give away prizes. So he's going to ask you to put something in the chat, and then he's going to look through the chat and give away a prize. And today we are giving away a hormone test. So you're going to be able to test your hormones for free, and we'll send you the kit to your house. And so we're going to give that away. And also we're going to give away a bottle of Daily Glow. Daily Glow is my all-in-one multi-nutrient, multi-mineral. It helps with your hormones, helps with your immune system, and helps with your thyroid. And it's really, really awesome. Also helps with your hormones as well. So, all right, what are we going to do? What are we going to do for today? Do we have a riddle? Do we have a word we want to say? Do you want to know if they have a pet? What do you want to know?
If they have any cats.
Okay, so if you have a cat, right, tell us your cat's name. And if you have any other animal, tell us what animal it is. And if you don't have an animal, but you have a plant, let us know that you have a plant. But you know, it's not a prerequisite to have a cat to get picked. All right, so we're gonna let this scroll for a second, because I don't think there's that much of a delay. All right, Paxton, you get to pick. Here, you want to take my seat? You take the seat.
I'm
All
taking your seat.
So we're just going to take a couple seconds and give away some prizes. And if you are watching on the recording, put in your pet's name. Let us know what pet it is. And if you don't have a pet at all,
which one's the real one?
Let us know if you have a childhood pet or something like that.
Which one's the real one?
The real one? What do you mean?
Because I'm right here. I'm in your seat.
Oh, who's the doctor?
Yeah.
Yeah, so definitely put in the comments below the video if you're watching the replay. We'll give away one hormone test and one Daily Glow bottle on the replay as well. All right, so Paxton, you have to pick. Go ahead and tell me what the name is. Oh, you got that one?
Yeah.
All right, Julie Saracino, who said Dr. Paxton.
and tell Ranger that I love them.
Okay, so you're picking those two?
Yeah.
Okay. Oh, you just want to tell Rain? Yeah. Okay, yeah. So we'll do those two. All right. So Julie, you've won the hormone test. You just have to get it by writing into support at glownaturalwellness.com. So you're going to write in and say that you won the hormone test on the hormone happy hour and give us your address so we can send it to you. And then let's see, who is it? Nanette Shalby. Sorry about that. You said Ranger is our cat's name. Paxton said tell Ranger I said hi. And you're going to win a bottle of Daily Glow. So same thing, email support at glownaturalwellness.com, and we will send you that bottle. Let us know where to send it to you. And if you're watching on the replay, go ahead and we will do that. And in a couple days, Paxton will pick a winner. Thank you, Paxton. Woohoo, prize control. Bye, honey. All right, back to questions. All right, let me get back into the questions. Go ahead. He was trying to get out. He was like, is it a push or a pull? All right, bye. Awesome. All right, Paxton loves giving away prizes, so we do this every time. All right, the ranges on blood tests for hormones are huge. How do I know whether I'm too low after menopause? So yeah, so generally, I would say if you're doing a blood test for estradiol, and I would say you want to be at least for symptom relief and for protection, you want to be between 40 and 80 on a blood test. Now, if you're still cycling, if you're in 25, 30 years old, your estradiol levels are going to be like anywhere between like 185 up to like 400. If you're pregnant, your estradiol levels are going to be over 3,000. But for someone in menopause, between 40 and 80 will give you what you need to get there. Now on saliva testing, it's completely different. We measure in different levels. So I like it to be between like 2 and 5. And so that's kind of where we try to get. But caveat, Some women don't feel good at that level. Some women need more and some women need less. So these are ranges, and these are for most women, but not all women. All right, how can I find a doctor in Las Vegas that will treat and believes in menopause hormones? You're gonna have to ask your friends, ask around. Not all doctors, I so funny, believe in hormones. It's not like Santa Claus or the Easter Bunny. Like hormones are real, and there's so much research and so many studies that support hormone health and menopause hormone replacement for longer lives. So one, look for a woman. Two, look for a woman who's like in her late 40s, early 50s, because you're going to get more compassion. And then let's see, you're 79, do not sleep. So that's the other issue. So one, you have to find a doctor that believes in hormones. And then you also have to find a doctor who doesn't subscribe to the false information that hormones can only be used 10 years after menopause. So that's absolutely not true. Now, it's optimal if you replace your hormones right as you're losing them. So before you even hit menopause, just like it's optimal to start saving money when you're young, you save for retirement. And then when you get to retirement, you got money. But if you got to retirement and you didn't save any money, should you not save any money now? No, you should start a savings now, but it's not going to help you as much because it didn't build up. Same thing with hormone replacement. You can replace your hormones at 79, but you're going to have to start a little lower. You have to go a little slower, and you won't get as much benefit as you would have should you started at 55, because all the things like your brain will already have some plaques in it from not having hormones for 20, 30 years. Your heart and your blood vessels might have already started to get brittle because you didn't have hormones for those years, but you can still take hormones and get the relief from your sleep and your hot flashes, and also the protection going forward. So you won't get more plaques in your brain, your vessels won't get more hard, your bones won't get more weak. But yeah, you can totally find, but if you want to work with us at the Healthy Hormone Club, we work with people all around the country. It's super simple. You don't have to leave your house, but you do get to consult with a live hormone specialist. So we do the testing. Well, first we have you fill out a questionnaire, basically an intake form. Then we send you out a test kit. If you do your tests right away, you get your results back within a couple of weeks. Then you book your appointment with your hormone specialist. It's either via Zoom, like where you're one-on-one talking like this, or if you prefer a phone call, we can do a phone call. We go over your results with you. You have a patient portal where all your results and protocols are in there. You also have access to the Healthy Hormone Academy. And then once you have your hormone consultation, then we get your dosing. We ship your hormones to you. They're super easy to use. Topical creams, you just pump them on your skin, rub them in, and it's dosed perfectly for you. And then should you have any questions at all, you can always just reach out via chat, and we can get you on a call with a hormone specialist, usually within 24 to 48 hours. And that's as much as you need. And so if you're having trouble finding someone, we would love to help you. But if you want to work with someone locally, you can ask around. You can go to the American Academy of Anti-Aging, or A4M, American Academy of Anti-Aging. And those doctors tend to be pro-hormones. You can look up doctors by location, and most doctors on there are going to be pretty much pro-hormones. They're very much into technology and science. And so you should be able to find someone on there if you want someone local, but otherwise we would love to help you in the Healthy Hormone Club. You can email us at support@glownaturalwellness.com or post below. I'll put the link below this video on the replay, but you can save money on the Healthy Hormone Club just by attending these calls if the money is an issue. Let's see. Can you recommend a specific saliva and blood test that we can direct self-purchase? What I showed you, so this one right here, it is a saliva test, and we also have a blood spot version that you can purchase directly from us at glownaturalwellness.com. We do have a sale right now. If you mention this video, we'll still give you the sale price, even if you're watching it 5 years in the future, because that's how we roll at Glow Natural Wellness. So right now it's 50% off, and you get all your results, and you get, we'll actually give you recommendations. And then should you want to join the Healthy Hormone Club, because you found out that your hormones are too low, we'll credit you towards the price of the Healthy Hormone Club. So, and you can get started right away. Is it ever too late to start hormone therapy? No, it's not. Never too late. Now, is it, again, like just like the bank example or the retirement example, is it better to start hormone replacement therapy earlier? Of course, you're going to get more benefits, but it's never too late. As long as you're living and breathing and your body is always turning over new cells, it's never too late. But I would advise not waiting. So, if I knew what I knew 10 years ago, just like I was just having this conversation yesterday. I had some photos done for my website, and I had a girl, she was like 24 years old. She came over to do my makeup, and she was asking me what I do. And I was telling her, I was like, I wish I would have known about like moisturizer and sunscreen, like the importance of them when I was her age at 24, because then I wouldn't have any of the damage to my skin that I do have now. And, I could have protected my skin so much better. And she's like, well, it's never too late to start. You want to start now, even if you just started 5 years ago, that's better than not doing it at all. And that's the same thing with hormones. Yeah, it's better if you could have started right as you hit perimenopause, as your hormones started to decline and you just bumped them up to optimal levels and you never had any of the kind of atrophy and loss of collagen and all the things that happen. But start now if you haven't started before. And then you can be on hormones for the rest of your life. There's no time limit, there's no age limit, but there's like good, better, best, right? So best, starting hormones as soon as your hormones start dropping. Better, starting shortly after menopause or once your hormones have dropped down to low levels. And then good is starting when you learn that it's necessary or it's optimal for you and it's beneficial. So that's kind of how I feel. My husband has serious tinnitus and he's less than 60. Can hormones be a cause of his tinnitus? So I specialize in female hormones, but it may or may not be. It could be inflammation. For women, specifically, loss of estrogen can trigger tinnitus because there is a estrogen receptors on the cochlea inside the ear. And when estrogen drops, it can start having that ringing in the ears. So it could be the same for him. He could be losing his testosterone, which converts over to estrogen. Contrary to popular belief, men have estrogen and progesterone as well. So he might ask his doctor to test his hormones, and for men, they'll get estrogen tested as well, and he might be low. And for men, a lot of times how they'll raise estrogen is just giving them testosterone because some of it is going to convert over to estrogen. Let's see, when gaining weight in the belly and thighs, is this a hormone or a thyroid problem? I can't speak. Is this a hormone or a thyroid problem? It could be either. It could be both. So basically, if you have a thyroid problem or a low thyroid or suboptimal thyroid, you're going to have a lower, your metabolism is likely going to slow down and you will have more trouble maintaining your weight. So you can gain weight kind of overall. If you're gaining weight only in your belly, that's a good sign that it is menopause, because you might have heard of menopause belly, menobelly, all of that. That is really, really common because women tend to gain weight in their thighs and their butt because of our hormone makeup. And then men tend to gain weight in their bellies, and you've seen all the guys, right? The big belly and they have the skinny legs. That's their hormone makeup, testosterone, allows them to do that. And then so when our hormone profile switches, when we hit menopause, when we have testosterone is our most dominant, even if it's not high, even if it's normal, if our estrogen and progesterone are low, then we're going to have that belly fat weight gain. But if you have weight gain all around, then it's likely thyroid. And it could be both. A lot of women, when they hit menopause, they have both issues with both low estrogen, low progesterone, and then low thyroid. And if your estrogen and progesterone are low, it can also affect your ability to produce thyroid hormone. It can shrink your thyroid. So it could be both. And so I'd recommend testing. If you want to do the hormone trio test, we ask you the questions about your thyroid, and then we can see. Or if it was me and money wasn't, if you're willing to spend some money, we do offer a thyroid test. It's a blood spot test that you can do, or you can ask your doctor, hey, can you test my thyroid and not just TSH? So you don't want to just test TSH. That is what is commonly tested in conventional medicine. Sometimes they'll test T4 as well, which is the hormone that your thyroid produces that has 4 iodines attached to it. What you really want to test is the active thyroid hormone, the free T3. So that's the hormone that has the 3 iodines attached to it. So when your thyroid makes thyroid hormone, it makes it mostly T4 and a little bit of T3, and then it has to be converted to T3, which is your active thyroid hormone, with some nutrients and in the liver. And then that goes out to your body. And if you have a lot of stress or a lot of toxicity, then there's something called reverse T3 that will kind of put the brakes on your thyroid hormone, and that could be a reason. And then if you have a lot of inflammation, there's autoimmune thyroid antibodies, TPO and TBAG, which those can kind of attack your thyroid. So that's what you want to test. You want to test. So TSH is the message from your brain to your thyroid saying, hey, make some thyroid hormone. So that's on the test. Then you have your T4, your free T3, your reversed T3, and your thyroid antibodies. That would be a complete thyroid test. So hopefully that's helpful. So you can get that on our website. We have, if you go to glownaturalwellness.com, you can purchase a thyroid test. You can either get a blood draw or you can do it at home with a blood spot, either way. Or you can ask your doctor to run that if you have a doctor that is open-minded and doesn't mind taking some advice from the person they work for, which is you, right? Your doctors work for you, and so they should take your advice, but sometimes they don't. Okay, let's see. I'm 61. I stopped menstruating at 52, never did HRT, and it's been horrible. I've been finally diagnosed with more acute, no estrogen, ADD, hugely increased emotional, my temperature, my motor coordination, nervous and cognitive dysregulation, escalating blood pressure, weight, anxiety, stress, osteoporosis. Those are all the symptoms of having no estrogen. Yes. Is there any contraindication, any danger in starting the HRT 9 to 10 years post-menopause? Absolutely. As long as you get, I would say, don't do oral hormones, don't do specifically oral estrogen. You can do patches, you can do gels, you can do creams, but no, actually, I mean, even the most like people that kind of purvey the myth, they always say up to 10 years is what's like commonly said, but I just told you that it can be anytime. So you're actually in the perfect range. There's no reason why you shouldn't be able to take hormone replacement, and your life will vastly improve. I mean, you pretty much mentioned like all the symptoms. So you're going to notice immediate help right away with many of those symptoms. And then, with the blood pressure escalating, with the nervous system and the cognitive decline, this is the time you really want to jump in as soon as possible so you can prevent the incidence of dementia or Alzheimer's, which is, once you have dementia or Alzheimer's, then taking hormones won't really help you with reversing it because it's already there, but it will help it from getting worse. But if you can get in now, and now you're still in like the good range for preventing heart disease, preventing Alzheimer's and all of that, you're still in what's considered optimal timing. So but even if you said you were 72 or 75, I would still say jump in now. But we would start a little lower just because your body's not used to having those hormones. So we start you a little lower and then we build up. So that's how that goes. Let's see. Hopefully that's helpful. So I applaud you for coming on here, and I applaud you for investigating. And I'm sorry that your doctor, whoever you're seeing, isn't like telling you this, but that's why we're here. This is what the Hormone Happy Hours are all about. All right, let's see. Recently, I developed burning, hurting inside of my labia. I started applying Manuka honey and it's helped, but I still have it. Maybe it's a fungus or a virus. So it could be, it could be a sexually transmitted disease. It could be bacterial vaginosis. It could be yeast infection. It could be urinary tract infection. I would definitely probably go see a gynecologist or go to urgent care or walk-in clinic and have it checked out just to make sure it's nothing that requires any like serious treatment. If it's going away with the Manuka honey, as long as it's resolving, then you're probably fine, but keep an eye on it. If it gets worse or it just doesn't get better, then I would definitely go to a gynecologist or urgent care and see if you can get some help. In the meantime, you can do that, what you're doing, or you can also use a vaginal moisturizer, which will help, because sometimes what happens is when we lose estrogen as we get older, um, we lose the protective barrier on our skin, especially in our vaginal tissues, and it becomes dry and cracked, and that can create alone the itching and burning, especially when we have less moisture and our vaginal microbiome starts to get a little out of whack. So applying vaginal moisturizers with vaginal estrogen can be super helpful for building up that protection back and creating more elasticity. So your skin's stretchy, where when we get older and it dries out, it's not stretching anymore. It's kind of like an old rubber band. You try to stretch it and it breaks. That's what can be happening. So you might not have like any and the honey is actually very moisturizing. So I think that's why it's helping you. But if you want kind of, because I assume it's kind of messy, if you want something non-messy that you can be using every day, check out our Glow Below product. We offer it with estrogen and with DHEA. The dose is very, very minute, and it stays local to your vaginal tissues. So it can be used in addition to hormone replacement therapy, or if vaginal symptoms are your only symptom, you can use it without using hormone replacement therapy. It's not going to raise your blood levels of hormones, and it's not going to go to all the other areas of your body. It's just going to stay local to your vaginal tissues. And it has a lot of other benefits as well. You can check out Glow Below on our website, or you can also go to the link under this video when I do the replay. Let's see, what is the optimum BHRT target range for progesterone, estrogen, and menopause? So it depends on what type of testing that you're doing, because they're measured in different increments. But for our saliva test, we like to see it between 2 and 5, 2 and 6 for estrogen. And then for progesterone, we kind of like to see it, oh man, it's a much larger range, like 300 to 3,000. Blood, I think it's between like 3 and 5 for progesterone, and for estrogen, it's like 40 to 80 for menopausal women. So, and then if you're doing dry blood spot, I don't have those ranges memorized, but, and then if you're in the UK, you're going to have different units of measurement. So that might be different, or in Canada. How often should one get the hormones tested? If you're on hormone replacement, I would say at minimum every 6 months. If you're not on hormone replacement and you're in menopause and you're trying to see when those hormones drop, I would say once a year, just to see where you're at, if it's time to get on hormone replacement. And if you are premenopausal, but you have PCOS, if you have painful periods, if you have endometriosis, any of those things, I would probably go at once a year as well. Or if you're trying to get pregnant, then you'd probably be testing more often. So those are kind of some different reasons. Let's see. How can estrogen and progesterone help the spleen, low blood sugar, or sugar spikes? So estrogen specifically is super helpful for allowing your body to use insulin or use your sugar. So basically it helps your body to pull the sugar out of the bloodstream and use it, where when we lose estrogen, we're more insulin resistant, and we kind of store more fat, and we don't use our sugars as well. This is why a lot of times when women get to menopause, they can't eat the same way. They can't eat the carbs anymore. But with the hormone replacement therapy, especially estrogen, can really help with balancing blood sugar. See, how long after stopping birth control pill is the optimal time to test hormones? And is one method better than the other? I would say you want to wait at least 3 months after stopping birth control for your cycle to kind of get normalized. For some women, it might take a little longer. If you're still getting your period, I assume if you're on birth control pill, but I shouldn't assume that, because a lot of doctors will treat menopause with birth control pills. So if you're still cycling, once your cycle comes back, then that's like when your hormones are going to be pretty much normalized. But if you're having specific issues that you're dealing with right now and you want to get off birth control and onto hormone replacement, then you can test right away and then test again in another 3 months to see where you're at and adjust your doses. So you don't have to wait, is what I'm trying to say, is you don't have to wait for getting a relief. But if you're just coming off birth control and you don't really have any symptoms that you need to deal with, then I would probably say in about 3 months should be for most women. For some women, it's going to take a little longer for your hormones to come back. See, I don't want to lose this question. What is the hormone testing if you don't have a cycle? It's the same test. It's just you want, and you can test on any day. So for women with a cycle, they would want to test on specific days. For estrogen and progesterone, we recommend 5 to 7 days after ovulation. But if you don't have a cycle at all, you can test any day that you want. The only caveat is to get optimal testosterone levels, you want to test in the morning. So I would say between 7 a.m. and 10 a.m. if you wake up at a normal time. You can push that a little bit if you're like a night worker and you wake up, let's say you wake up at noon. But I would say within the first 3 hours of waking for testosterone to be at the perfect level. Otherwise, if you test testosterone later in the day, you might get a kind of false low level. And so for accuracy purposes, you want to test in the morning. Estrogen and progesterone, not so much. It's not that important, but I would say if you're doing like the hormone trio test that we showed you earlier, then just test them all in the morning, and that would be great. Should postmenopausal women have their hormones tested as well? Absolutely. My opinion is that postmenopausal women should be replacing their hormones in order to live a long, healthy life and prevent heart disease, Alzheimer's, osteoporosis, rapid aging, vaginal dryness, hot flashes, weight gain, all the things. So I think that you should test your hormones and replace your hormones. And I don't feel like anyone should be replacing hormones without testing. And then you should retest just to make sure that your hormones are in range and everything's looking good. And that's kind of what I recommend. Is there any health risks to beginning BHRT at 61, 10 years post-menopause, along with 30 years of taking Hashimoto's? So yeah, so I think I kind of talked about that earlier. There's a huge myth going around that women can only use hormones within the first 10 years, and then it's dangerous somehow for women to start hormone replacement afterwards. It's not dangerous, and that women should only use hormones for 10 years, right? So those are two myths, that you can only be on hormones for 10 years, and that you only have this window, this like a magic window, that's this 10-year window. Now, one, you can use hormones till end of life, and there's many, many studies that prove that. The reason why they used to say that you can only use hormones for 10 years, it's kind of similar to why, if you've ever seen any recommendations for pharmaceutical osteoporosis medications like Fosmax, any of the bisphosphonates, they say you can only use it for like 3 to 4 years because it's actually damaging to your body. And so synthetic hormones, they're damaging. They're not good. They're like toxic. And so you should use this for the shortest amount of time possible. Bioidentical hormones are health promoting. They're actually helpful for the body. So there's no limit. Now, within that first 10 years of menopause, when your estrogen declines, you have no estrogen, that's when your collagen is going to dip. So you're going to see rapid aging. That's when your bone loss is going to start happening. That's when your arteries are going to harden up. That's when you're going to start developing plaques in your brain, because now you have all this time without estrogen. And I'm talking about estrogen mostly, but progesterone is part of it as well, just not as big a part as estrogen is. And so, yeah, if you can, definitely replace the hormones sooner. The sooner you can be without, or the faster you can not be without the estrogen to help with all of this, like your blood vessels, your heart, your brain, your skin, even your gut health. If it's important for gut health, certain bacteria in your gut need estrogen and progesterone to thrive. So all the things, if you cannot be without it for 10 years, that's the best. But the sooner you can get it, even if it's 11 years or 12 years or 14 years or 24 years, will there be some damage that happened for not having the estrogen and progesterone for that long? Yes, there will be. Will it be reversed when you start taking the estrogen? We can't say for sure, but we can prevent further damage and we can improve quality of life by replacing hormones at any age. You just want to go to a practitioner that dials and doses for you. You want to work with someone who's going to give you an individual protocol. There's a lot of like online menopause hormone replacement clinics where you just get the same dose as everybody else. They say you have a consultation, but you actually just are like filling out a questionnaire basically. And so I'd actually work with a company or a clinic that is going to give you some one-on-one support. and dial in your dose, maybe go a little slower, just to get your body used to the hormones, but there's absolutely no reason why you can't take them. Where should we put our BHRT? Insert or rub on, or where? Is there a tutorial? So if you're doing topical creams, you can put them on any area on your body that has no hair follicles or low amounts of hair follicles. And usually the skin's a little thinner. That's going to be optimal for absorption. So we say anywhere from your wrist to your elbow. You can rub them in like this, like you pump them on your arm and then you rub them in. You can do them behind your knee. You can do them on the lower abdomen. You can do them on your neck. And so those are like the main locations. Some people, you can even do them on the top of your feet where you don't have hair. So anywhere there's no hair follicles is the optimal dose. But if you want a little bit of a slow release, some people are super sensitive and they need like a slower release, or they want to, there's some cases where we'll do put it on your butt or on your outer thigh. But the main areas for topical hormones are there. Now, if you're doing a patch, they'll usually put that on your butt or on your hip. If you're doing injections like a pellet, then they'll place that inside your butt. And that's pretty much the different methods there. You can do oral hormones too, but we don't recommend those. Let's see. In one of your videos in the Hormone Academy, you mentioned that you can get all of your hormones balanced according to testing. But if you are still having hot flashes, there may be something going on with your adrenals. Yeah, so there's other reasons for hot flashes besides just estrogen. If you have gut imbalances, so I used to have parasites and I would get super hot just because like the inflammation and the parasites, or if I eat a food that I'm sensitive to, I also get hot. So there's different reasons why. And if you're under a lot of stress, you can get hot. Like that's why you start sweating. When you're under stress, you get sweaty palms. Those areas also control your vasomotors. Should I get my adrenals tested if I'm still getting hot flashes 6 months in? So if you haven't already, you might need to adjust your dose of hormones. So check on that. There's also some breath work inside of the Healthy Hormone Academy. And there's studies that show that the breath work, because of the impact it has on your adrenals, can reduce hot flashes by 30% in women who otherwise have balanced hormones but still get hot flashes. So there's that. And then there's also inside a Healthy Hormone Academy a self-hypnosis. So basically a recording that you listen to while you're relaxed that will actually help to regulate your vasomotor temperature regulation system. So try those things first. They're free. They're already included. But if you have other symptoms of adrenal imbalance and you want to test those, you can totally do that. We can do that with the same test that you're using for your hormones, or we can send that out to you. Just ask. You can use the portal and chat your message if you want to, or you can email us, and one of the hormone specialists will get in touch with you and see if you'd like that hormone test, the adrenals. But yeah, but definitely book a consultation with a hormone specialist in the Healthy Hormone Club. It's free. You don't have to pay for consultations in that program. And then we kind of dial in with you what needs to get done. But definitely check out the breath work and the self-hypnosis inside of the Healthy Hormone Academy. Let's see, is the saliva test you offer, do you provide guidelines? Once you provide the sample based on one's, yes, we do. So if you purchase a hormone trio test, a saliva kit, we will tell you exactly when to take the test. If you're not sure, you can just email support, and one of our hormone specialists will contact you to kind of dial in when you should be taking that. If for some reason you take it at the wrong time, just let us know. We'll hook you up with another test. We can totally do that. So we're not going to make you do the test wrong. I think I saw someone in the chat when Paxton was here saying, oh no, I took my test at the wrong time. If you did it with us, let us know. We'll send you another one. Let's see, is there a certain serum estradiol that you look for in order to receive the cognitive bone benefits? So yeah, between 40 and 60 on serum. If you're doing oral hormones or injections, if you're doing topical hormones, your serum levels will not reflect accurately because it's not a good way to measure topical hormones. So, but for oral hormones or injections, sometimes patches sometimes they'll show up. So between 40 and 60 on the test is where most people need to be in order to have those benefits. let's see, 4 years, but that's not saliva. Saliva is like between, I would say, like 2 and 5. Let's see, after 4 years, I'm still trying to find and tweak ADHD medication. Are you knowledgeable about ADHD and hormone imbalances in women, as well as zero estrogen making? Yeah, so ADHD is a neurological disorder, right? And just if you didn't have ADHD, the general population, when they lose estrogen, they have more ADHD-like symptoms because we're not able to focus, we're not able to deal with some situations. And so I think that there's no reason why being on ADHD medication would be a reason why you can't take hormone replacement therapy. But I would recommend working with your prescriber if you need to adjust the medication for ADHD. We're not going to change your medication. That's actually illegal for me to do that because I'm not the prescriber on that medication. But I really feel as though hormone replacement therapy is a great adjunct to that, especially if you're in menopause, especially if you have low estrogen, then that will actually make your ADHD medication more effective. In some cases, I've seen some women who were menopausal. They went to their doctor with all their symptoms. They were told they had ADHD. They got on ADHD medication. Then years later, they started looking into menopause and hormone replacement. They replaced their hormones and they actually didn't need their ADHD medication any longer. So not saying that's going to be the case for you. Every woman's different. And so definitely talk to your doctor. If your doctor prescribes hormone replacement therapy, maybe you can get it through them. Otherwise, we're happy to help you as well. But we can kind of coordinate with your prescriber, but we're not going to change the dose. And so, yeah, I don't think, let's see, I think the question was, oh, so you like your provider. Awesome. So yeah, you don't need to switch, but yeah, we can work with them to help you. What are normal levels of hormones? I think I explained that earlier. And normal for one person is going to be not normal for the other. That's why I love the idea of women who are way, way, way premenopausal, like in their normal reproductive years. If you can get your hormone tested then you're going to know your normal levels. But there's ranges for normal, depending on what day of the month it is, where you are in your menstrual cycle. Let's see, cortisol imbalances used to wake me up at night with hot flashes and night sweats. I noticed you don't test for cortisol. We do test for cortisol. I'm just specifically talking about menopause hormones. So we do test for cortisol. We have that test available, as well as thyroid testing and vitamin D testing and C-reactive protein and blood sugar, CRP. So we test for all those things, but specifically on these calls, I'm talking about menopause, perimenopause, hormones, hormone replacement. So I showed you the test that we use for hormone replacement therapy, but yeah, I would definitely recommend testing your cortisol. It's actually the same test. So this test here, also a cortisol test. So I showed you guys the one vial, right? So that's for the hormones, but if you're doing the cortisol test, you actually do 4. So you actually will sit in the vial, get your saliva sample at waking, and then you'll do another vial mid-morning, you'll do another vial afternoon, and then you'll do another vial like around like nighttime. And so basically you're going to see your circadian rhythm, your cortisol rhythm. And it's supposed to, ideally in a perfect world, your cortisol will be low when you first wake up, and then it'll rise to its highest level, and then it'll gradually decline throughout the day. So that's basically you waking up, getting energy, and then you're gradually declining throughout the day so you can go to sleep at night, and then melatonin is going to be high and cortisol is going to be low. So we absolutely test cortisol. Our kit is all set up for that. But I'm just speaking, what I showed you earlier is basically just for hormone replacement therapy or female hormone balance. Can you compare the results of blood tests that you have with saliva tests? So if you're not taking hormones at all right now, then the results are going to be similar, but the ranges are different because it's a different unit of measure that's being used. But if you are using topical hormone replacement, then the blood test is not going to be as accurate because it doesn't pick up the hormones in the tissue. It only picks up what's in the serum. So hopefully that's helpful. but they're both accurate. So you can do urine testing, you can do saliva testing, you can do dry blood spot testing, you can do serum testing. You can test all those ways are accurate ways to test your hormones. But if you're using topical hormone replacement, then there's blood spot, saliva are the best. You can still use the other methods, but you're not going to see your levels increase because the hormones are going to be directly in your tissues instead of in the bloodstream. Let's see, I'm 48, I'm in perimenopause, and I'm having heavy periods on a monthly basis for 2 years. It's gotten to the point where I've even needed a blood transfusion, iron infusions. Wow, okay. I've been diagnosed with adenomyosis and my hormones have been tested. They're all in the normal range. What would the condition of adenomyosis indicate? So that's where you're having like endometriosis tissue growing outside of the uterus. And so it could be due to low progesterone. So basically, 48 perimenopause, that is when progesterone declines. It usually declines before estrogen. Now, estrogen is what builds up the uterine lining, and progesterone is what thins it out so it can come out in your period. Now, it's very, very common for women to have heavy periods in perimenopause because their progesterone has declined, but their estrogen hasn't declined yet. And so one very good way of kind of preventing that from happening is to optimize that progesterone level. And your practitioner may not know this. I don't know if he's looking at your ratio, your estrogen to progesterone ratio. However, once you already have that tissue growth outside of the uterus, then you likely will need to have it removed surgically. There's some very, very good doctors that do this on a daily basis. And I just make sure that you go to one of those because you don't want that growing elsewhere. So, but I would definitely look at your estrogen dominance. And one of the main reasons for this as well is toxicity. So there's many, many environmental toxins in our lives that mimic estrogen and can create these estrogen dominance type situations where it's not the estrogen your body is producing, but it's like things like BPAs and plastics and xenoestrogens, and those can act like estrogen in the body, and that can create this overgrowth and this excessive bleeding. So there's a lot of different reasons why I would have to like examine you in order to know, but definitely there's this hope and there's help for you. It just probably isn't just hormone replacement. There's probably other things going on as well. Let's see, do you do testing and replacement for DHEA and pregnenolone? We do DHEA replacement and we do test DHEA as well. We just don't have it on the test I showed you, but in the Healthy Hormone Club, the first test that we do include DHEA as well. And pregnenolone, we don't test or replace that. Just because pregnenolone will convert to other hormones. And if we're doing hormone replacement, we won't be able to predict what the pregnenolone is converting to. But you can use pregnenolone if you like. If you're not doing hormone replacement therapy or you don't want to, you can get pregnenolone over the counter and see if that gives you some symptom relief. But there's no way to know what pregnenolone is going to convert to. So there's no way to dial in that replacement. So that's why we don't use that. And most my training through the American Academy of Anti-Aging and all the hormone training that I know and that most clinics do. Pregnenolone is not popular. Some health coaches will use it because it's available over the counter, and some doctors will use it. There is some benefits for brain health and things like that. So if you're not using estrogen, progesterone, DHEA, if you're not using any of those things, you can use pregnenolone. But we just don't use it because we go directly to the hormone that we want to impact so that we can dial in that level. What are symptoms that show you have a high cortisol level? There's a lot of them. It's usually like that stressed out kind of scenario where you have anxiety, hot, you're feeling warm, you have rapid blood pressure or rapid heart rate, high blood pressure. You're stressed out, you're tired and wired, like you're wired at night, you can't sleep, and then you're tired in the morning, or you're just wired all the time. And then a lot of times you'll have like that high cortisol, and then you'll have the drop where it becomes low cortisol. So yeah, I mean, there's a We can do like there are hormone trio test has a lot of those symptoms on there that are high cortisol symptoms, but yeah, it's generally like the like stressed out, inability to deal with stress, irritable, anxiety, those types of symptoms are high cortisol symptoms. But a lot of symptoms also might be high cortisol as well that you might not attribute, things like hot flashes, which a lot of people attribute to estrogen, but they can also be high cortisol as well. And that is one of the reasons why we are so big on hormone testing, is because hormone symptoms tend to overlap, so you can have a symptom and it might not be due to high or low estrogen. It might be due to cortisol or thyroid. And so that's why we like to test and then also evaluate symptoms. Let's see, would you have a chart that indicates international measurements? I'm from Canada and the numbers will be different. Well, when we're testing, if you're testing through us, we'll give you the reference ranges. If you're talking about for blood, I think I might have a chart. So let me look for that. And if I do, I'll post it under this video. Because we have in our Glow Protocol program, we have like a guide to understanding your blood tests. And I'm not sure that I have the European units, but you can always Google and convert those units as well. Oh, thank you so much, Linda. I try my best to answer questions as best that I can. Let's see, what types of hormones do you prescribe, claims, packs? In our program, the Healthy Hormone Club, we use exclusively topical hormone creams because those are the safest, they are the easiest to adjust, and they have the least side effects, even like not like scary side effects, but even like patches, there's a lot of rashes from the adhesive and some toxicity there. So we love the topical hormones because you can adjust them on the fly. We can say use a little more, use a little less. We can also increase and change the potency within the creams. And then we can adjust, okay, use them at night, use them in the morning. So we can do that. And also there's really no side effects when it comes to like the deep vein thrombosis and the clotting and the stroke risk. That's not there with those. So we really like them because they're so easy to use. And so that's why we use those, but I don't have anything against patches. I don't have anything against other forms of hormone replacement. If you can get hormone replacement from your doctor and they're giving you a patch or something else, I applaud you. I'm happy for you. I'm just telling you what we use in our practice. But I don't have anything against the other forms. The one I'm not a big fan of is pellets. Pellets tend to be very, very high dose. They tend to give you a big boost of hormones in the beginning and you can't adjust them at all. So you're stuck with that dose for 3 months, whether you're having side effects or you're feeling horrible or you're not getting symptom relief. So I'm not a big fan of pellets, but I will also support you if you're on pellets because I just want women to feel good. So hopefully that's helpful. All right, you guys, let's see. So we've been over an hour, like an hour and 20 minutes. I'm going to try to answer a couple more questions. And we'll get back from there. Let's see. Why would my surgeon take me off progesterone? Should I go back on progesterone if my ovaries are intact? I'm not sure why your surgeon took you off progesterone, so you might want to just ask, but I would personally recommend progesterone, especially if you're replacing estrogen. You definitely want to replace progesterone, especially if your ovaries are intact or your uterus is intact. There's a lot of doctors who believe that progesterone's only use is for protecting the ovary or the uterus from having excessive buildup. So protect you from uterine cancer, protect you from excessive bleeding. And so a lot of doctors will say, if you don't have a uterus, you don't need progesterone. But we now know that progesterone is super important for anxiety relief, to feel calm, for sleep, for stress levels, for cognitive health overall. People who have traumatic brain injuries, one of the treatments that is like one of the best treatments is actually progesterone because it really helps the brain heal. And so I would say, that's probably why they said you don't need progesterone, because if you don't have a uterus, but I would definitely recommend progesterone. Let's see. Thank you. If I get tests ordered through you, let's see, blood tests, can I use my insurance to pay for it? Get through LabCorp. We can provide you with a receipt to get reimbursed through your insurance, but we do not We're not in network, and we don't fill out insurance paperwork or anything like that. That allows us to keep our costs low. And so we don't do any of the insurance things. Also, with insurance, like if the insurance company doesn't believe it's medically necessary, then they won't reimburse, and then we'll have to raise our prices for that reason. So we don't handle insurance in our practice. However, we do provide you with a receipt that you can get reimbursed, that they will do that for you. Let's see, can these tests be done under insurance? Yeah. So yeah, if you have an OBGYN or an endocrinologist that you're working with and they are going through your insurance, you can absolutely ask them to run it. Sometimes they will deny you though, because they might say, oh, well, hormone testing is not necessary. But if your OBGYN or your gynecologist or endocrinologist can like really give a good case for it, then a lot of times it can be covered. So definitely, let's see, I've been in menopause for 2 years. I've been diagnosed with osteopenia. Definitely this is the time, get on that estrogen replacement right away. And then also, make sure you're eating your protein. Protein is part of that matrix that forms inside your bones. So a lot of us know with osteoporosis, a lot of us know that calcium, right? We hear about calcium because that is what makes that hard outer component of our bones. But calcium does nothing to build the matrix of the bone. So it really doesn't help prevent fracture. And so we need that protein and those minerals like magnesium to really help to promote that matrix of the bone. And so make sure you're eating enough protein per day. Make sure you're getting some weight-bearing exercise, preferably resistance training. Make sure you're getting your rest and your sleep. Stress is the one kind of bone breaker downer. So definitely those things. But yeah, one of the best things you can do to build that matrix is going to be estrogen replacement. So yeah, get on that as soon as you can, and you'll see your numbers within 18 months. You can see, we see it all the time. You can be like a -3 on your DEXA and go to a -1 or 0 in no time. So what about urine testing? So urine testing is great for looking at metabolites. So we like the Dutch test, or there's one by ZRT or Meridian Valley that measures hormone metabolites. That's amazing. You can also get adrenal cortisol levels in the metabolites, and you can also get melatonin in urine. So I really like those tests. They just tend to be very expensive. So where we can sell you the hormone trio test for like $150, including your results analysis. The Dutch test, which is a wonderful hormone metabolite test, is like $500 or $400 or something like that. So I don't think it's necessary unless you want to know how your hormones break down, which is great. I mean, I'm a doctor and I love natural medicine. I'm kind of a science geek. So of course I love that test because it gives you so much data. But if you're just looking to replace your levels to prevent osteoporosis or to prevent heart disease or to help with your wrinkles or your belly fat or any of those things, it's not necessary to test those levels. We always will give women support for estrogen metabolism without even testing, because everybody can use that help. So we always take that into account. But if you really want to look at your numbers, I fully support that. I love what we offer in our practice, but it's just kind of out of the price range for many people, I'll have to say. So we love having an affordable, easy to do test that everybody can afford. Well, most people, I should say. Let's see, to clarify, I'm using a progesterone cream and taking DIM to support balancing progesterone and estrogen. I'm not on birth control when I'm 30 years. Okay, so it looks like that's a follow-up to a previous question. Okay, that was the person that has the endometriosis or adenomyosis. So you are taking progesterone. So yeah, so you may not be using enough progesterone. I'm not sure on how much you're using. You might need to go up in your dose. And then it could also be genetic. There can also be other reasons why it's happening to you. So it's not necessarily anything you're doing wrong, but there is help for it. And then to prevent that in the future, you want to make sure that your estrogen and progesterone balance is dialed in. It looks like you're doing that with your practitioner, so that's good. Do pellets cause high blood pressure or blood clots? No, if you're at the right dose, I would say no. They don't cause those things. Let's see, I'm perimenopausal. I think that's a follow-up. Let's see, I'm a personal trainer. I was shocked to know that I have osteopenia. I know, isn't that crazy? But even if you're doing all the weight-bearing exercise, the thing is, when estrogen drops, it's like almost a guarantee that you're going to start having bone loss. I eat very healthy and wonder if oxalates are causing my osteopenia. If you have a problem with breaking down oxalates, it can cause things like kidney stones and calcium deposits, but I don't think it's causing your osteopenia. I guess it could block some of the nutrients from getting absorbed, so it could be a contributing factor. And what you can do is if you like foods that are high in oxalates, you can just cook them to break down the oxalates. So no more like raw kale or raw spinach, just cook it. Even if you're going to put it in a smoothie, a trick I like to do is I'll boil or cook the kale and the spinach and cook it down and put it in little ice cube trays. So now I have these little kale cubes or these little spinach cubes. And so that gets rid of the oxalates. You want to get rid of the water that's cooked in. So don't use that to make your smoothie. And then you just pop it in the freezer. And then whenever you're going to make a smoothie, you just take out 1 or 2 of those cubes, those little kale ice cubes or spinach ice cubes. And then you can put that in and it makes your smoothie nice and cold, but then the oxalate level is severely reduced. So hopefully that's healthy. Let's see. Are you able to prescribe hormones in Arizona, California, Nevada? We work with the entire country through a healthy hormone club. Let's see, a PPO. We don't take insurance though. So our fees are super low. It includes all your testing, all your consultations, all your hormones, all your shipping, the Healthy Hormone Academy, unlimited support. And right now we're offering it for $139 a month or $1,399 for the year. Just as a comparison, like that Dutch test that we were talking about, that's like $400 or $500 just for the test. We give you all your testing, all your support, all your hormones. If you're in the United States, the shipping's included. So it's all included for like less than you would like probably your copay of your insurance. So hopefully that's helpful. But if you want to go through your insurance, then you can find a local practitioner that might be able to do that and take your insurance. See, I'm thinking starting to shift with my cycle. I'm sorry. Blah, blah, blah. All right. I think I'm starting to shift with my cycles. I feel like I'm doing tongue twisters. Turning 50 this year, where do I even begin? Is it too late to get myself on the right path? Absolutely not. You are in the perfect time. Oh my God. This time right now, you're shifting your cycle as you're turning 50. This is a perfect time to get your hormones tested. Perfect time to start topping off your levels or replacing your hormones if you need that. Definitely anything you do to improve your lifestyle, healthy food, sleeping, stress reduction, exercise, any of those things will also be absolutely awesome for you, but you're at the perfect time to test hormones and replace them. I'm glad you're here. Get on it. I think that you're going to really love it. Yeah. So I think you're not going to be in the wrong place at all. You're a perfect place. What is the best HRT method? I'd like to utilize my own eggs for cryo. I love topical hormones, either through gels, creams, or patches. That's my favorite method for replacing hormones because they're safest and there's least side effects. Patches do have some side effects with the adhesive, can sometimes cause irritation and toxicity. And also, if you like to take baths or shower often or swim, the patches can come off, and that's like a headache. So that's why I like the creams. They absorb within 15 minutes. So you're good to go. You can go swimming after that, and it's not going to cause any issues because it's fully absorbed into your skin. So that's kind of where I like that. Let's see, there's an office I can visit concerning my issue. I'm definitely having hormone issues. I can't lose weight, severe hair thinning, 61 years old. I cannot lose weight no matter what I do. I hear you, girl. I hear you. I've been there. I actually was diagnosed with premature ovarian failure in my 20s. And I basically had all the menopause symptoms. I was a track star. I was running track and I was gaining weight and I was hardly eating. And so I feel your pain, but you don't have to actually go into an office. You can meet with a hormone specialist just like this via Zoom. We have a HIPAA compliant Zoom. And then also we do phone calls. So we can help you with the Healthy Hormone Club. Or if you prefer to work with someone locally, you can definitely go to the American Academy of Anti-Aging and find a doctor on there, a4m.com. And that's a good place to look for like science-based, forward-thinking doctors, but we would love to help you. So definitely check out the Healthy Hormone Academy. If you haven't seen that, you can go to our website, glownaturalwellness.com, and you can look on there. I think it's one of the first things on the Work With Us, and you can learn all about that. Don't be scared with the price though. We do offer 50% off for all of our YouTube followers. So the regular price is $299 a month or $2,999 a year. But if you are one of my YouTube followers or one of my email list subscribers, then we do a 53% off most of the time. We have different sales going on throughout the year, but if you hear me talk right now, you can just email our support at Glow Natural Wellness and we'll send you a link. So it's $139 a month or $13.99 per year, based on when I'm speaking right now. So this is March 25th and we're in 2023. So if you're watching this like 5 years from now, I don't know if that price still will be in existence, but you do lock it in. So when you join, you do lock it in for life. Awesome. Let's see. Can you say more about why saliva is better than blood? I'm just saying it's better than blood if you're using topical hormones, because topical hormones will not show up on blood serum testing because they don't stay in your bloodstream. They actually go right into your tissues a lot faster than oral hormones will. But if you're not on hormone replacement therapy at all, you can absolutely do blood testing. You can do any type of testing you want. Blood, saliva, urine, dry blood spot. But if you're on topical, specifically topical hormone replacement that goes through your skin, I recommend saliva or dry blood spot. So hopefully that's helpful. See, I did my testing considered postmenopausal, but I'm wondering is that because of my hysterectomy or because of my hormone levels? So if you had a hysterectomy, a complete hysterectomy, and they removed your ovaries, then that would mean you're postmenopausal because you don't have any hormone producing organs. Your ovaries are gone, so you're not going to be able to make estrogen and progesterone. So therefore, you're in the postmenopause range, which you want to replace your hormones. Or if you had a hysterectomy, they left your ovaries in, but you're of perimenopause or menopausal age, then you also will have low estrogen and progesterone because maybe your ovaries are not producing those anymore. So either way, I would say go ahead and replace your hormones. All right, you guys, I've got to run because it's 3:33 and it is, we have some people coming over for dinner, so I have to get ready for that. But I do see a lot more questions, you guys. There's lots of people on. So I am going to go through all these questions and I will create more videos for you guys. We're going to start doing these every week. So definitely, we will definitely get your questions answered one way or another, but you can also just expect me to come out with more content and more videos for you. And we will just help you out as much as you can. Definitely, if you have questions, if you do not get a question answered, you can also message me on social. If you're in my Facebook group, you can message on there or pop it below the here. I'm going to download the Q&A, so I will make some more videos if there's questions I haven't answered before. Are you still having a special on your 1-year program? Just email support at Glow Natural Wellness, say you want the special, and we will give that to you. But we generally run that special a lot because I'm a big fan of making things affordable. So again, $139 a month for it's basically $1,399 a year, or we'll break it up into monthly payments of $139 a month for the year. But once you join, you keep lock in that rate. So we're not going to raise the price on you the next year because I believe that you should be on hormones forever. So we make it as affordable as possible. If that price doesn't work for you for any reason, just email support and see. Sometimes we do have financial assistance. Sometimes we have scholarship programs. So definitely reach out to us and we can see what we can do for you. Okay. All right, you guys, have a great rest of your day. I love you guys. Please like and share if you're watching on YouTube. Like my video, share my video, subscribe, because that helps other women see this. And that really helps women get the results that they want because they learn about all these things. So thank you so much. Hope to see you guys soon. I'll see you next week. Take care. Bye-bye.